Please welcome my first guest, Skip Allen, the clinical outreach dietitian at Novant Health, New Hanover Regional Medical Center. Hey, Skip, thanks for coming today.
Thank you. Thanks for having me.
Great to have you. You know, I think you're our first dietitian.
That's exciting.
It is exciting, and you're kind of a special dietitian. I mean, you're not your normal one that works in the hospital, in the cafeteria. So first, let's learn a little bit about you, your background, where you went to school, things like that.
Okay. Yeah. So I started my education at UNCW.
Oh.
So I love Wilmington. I was here for a long time in college. I studied exercise science as an extension of physical and health education. After that, I spent some time as a personal trainer and as a coach, but I went back to school and got my master's. This time I studied nutrition. I went to Meredith College in Raleigh.
Oh, yeah, that's a nice school.
Yeah, and I'm from Raleigh, so that was fun to be back then. And then after that, I spent a year doing an internship to become a registered dietitian.
Awesome. So you are a registered dietitian, but you have a specific skill set, I understand. So tell me about that.
Yeah. So what I do is a little different. I work as an extension of the inpatient team over at New Hanover Regional Medical Center. So as you mentioned, I'm not in the hospital very often. I work as a follow-up service for the patients who are leaving the hospital typically. And then also I work in the community here in Brunswick County and New Hanover County for some of the primary care facilities. Again, I'm based out of the hospital, but I try to reach out to the community and provide that care and bridge that gap a little bit more so that the patients don't have to be at the hospital to receive some nutrition care.
So you're an outreach type person. You go out into the communities, and you say you do cover Brunswick County?
I do, yeah. So I've got a couple different populations we work with, but right now I am doing some services for patients diagnosed with diabetes, and that service is extended actually anywhere in North Carolina, but right now we're focused on trying to get some folks in Brunswick County aware of that.
And do you, you don't see only diabetes patients, do you see a number of patients?
Yeah,
is that correct?
Yeah, so I see patients when they're leaving the hospital. There's some specific groups that need some care when they leave, somebody to follow up with them. And for those patients, I do home visits, which is also very unique. Yeah. Not many dietitians are doing home visits. But then also for the diabetes care and some of the nutrition education, we're using the computer software, telehealth services, Zoom, some of the other platforms. So the folks can be at home. They don't have to go to an extra physical visit. They can actually just receive those services where they're at. And again, for folks in Brunswick County, we want to make sure that anyone in the county has access to that resource.
If they don't have a computer, can you do it over the phone?
Yeah, we've done it over the phone, and I do like to send information through the computer, email. Sometimes I share some visual screens, some education tools, but if a patient prefers the phone and is comfortable with that, I'm happy to have a conversation with them.
For those folks anywhere watching this, do they need a referral from primary care, or can they just contract straight with you or New Hanover?
Yeah, I mean, if you think you need the nutrition education or would benefit from it, they do need to speak with their primary care physician or one of their specialists and have them send that referral over. From there, I can contact them directly to make it a little bit easier for them to get that appointment. I also do the scheduling for them, so hopefully if they can get that referral from their doctor, it shouldn't be hard for us to reach them.
Let's talk a little bit about blood sugar. I hear a lot about it, not too familiar with it, but folks with diabetes, they can kind of help themselves by keeping track of their blood sugars, correct? And how do they do that? Do they have the finger stick or?
Yeah, a lot of my patients do. You can find a glucometer. You can find that at the local pharmacy. You can get it at Walmart. You can order them online. Many times they're covered by insurance, so you could check with your insurance if they cover that for you as well. That is the most popular way I see folks checking things. Another way is a continuous glucose monitor, and again, some folks qualify for those through insurance, so speak with your doctor. You may be able to get a trial or something more long-term. And then outside of that, just having regular checkups with your physician, even if you're not checking things daily, having those monthly or quarterly labs done would be useful for checking those numbers as well.
I know diabetes education is kind of hard to come by in this area, but in exchange for that, maybe if they just contracted with a dietitian, that might help them achieve their goal too.
Yeah, and the nice thing for our services is right now we can take Medicare, Medicaid, and any private insurance. So I know sometimes for folks in the Medicare, Medicaid group, that's a harder service to find. So we're really hoping that, again, as an extension of that hospital care, we can reach out to some groups that maybe need that haven't had access to it in the past.
I wanted to go back to something you said about the continuous monitor. Is that the one I see on TV, the ad, and it's on their arm and they put their, how does that work?
Yeah, so there's a couple versions of them. Some are more popular than others, but they link up with your phone and they are able to kind of track that data remotely through the application that comes with the actual monitor. That information goes to you and your doctor, so that is something that you can keep an eye on, but also if you don't feel like you understand or you want someone to talk to about it, your physician sees that information as well.
Well, but I'm going to ask you a stupid question. How does it read it if it doesn't have blood?
Yeah, it sticks. I actually don't know.
I think that is the coolest thing if that's what it is and no sticks.
Yeah, it's a lot more comfortable.
Well, I'm going to have to research that because I've been watching that ad on TV and I can't figure it out.
Yeah, no, it's a lot more comfortable, and yeah, when you find out, you let me know.
Okay, that's a good idea. Typically, how long do you see a patient? Do you have them for weeks or days or?
Yeah, so what I like to do is at least have somebody speak at least 2 times. I try to have an initial interaction so we can learn about the diagnosis, we can learn about the diet, and really we can customize the diet for what your lifestyle is. And then I do like to have a follow-up, and I try to make that follow-up within a few weeks. And some patients do benefit from more visits from there, depending on how things are going, but at least 2 visits to get started.
Oh, that's nice. Well, we've talked a lot about diabetes. So March is National Nutrition Month, right? So thinking more broadly, what recommendations would you, let's talk about healthy choices in food. What recommendations would you make?
Yeah, I mean, there's all sorts of information out there about what you can do to be moving in the right direction for your health. But the best advice I can really offer is just to pay attention to what's in your food. If you don't know what you're eating, it's easy to not know if you're following certain rules, if you're hitting certain goals, and it's a great opportunity to figure out what's actually going in your body. So just to build that first habit, if something you're eating is unfamiliar or you're not sure what's in it, let's try to learn
Read the label,
it. Yeah,
right?
let's read the label, ask who made it, what's in it, and let's learn.
And shop on the outside of the grocery store, is that right?
Yep, another good tip is if you've been told something's good for you, sometimes it's harder to restrict the bad and to try to always be good. So, try to work in the good things, and the more often you work those in, then naturally some of those other foods might not have enough, you might not have enough room for them.
Well, that's great information. It will help I hope will help our patients to live longer, healthier lives. And it's been a pleasure to have you, and I'm going to research that, and we're going to get together and talk about that monitor.
Thank you.
Thanks so
Thank you for
much,
having
Skip.
me.
I appreciate it.